Welcome to 2026 Lacers Open Enrollment. My name is Chris Leah. I'm a benefit specialist here at Lacers. I'm part of the advocacy unit. This is the time to enroll in a plan, change plans, or add dependents. After open enrollment, this can only be done if you have a qualifying event. Changes made during the open enrollment period will be effective January 1st, 2026. Health plan renewals. Estimated overall premium cost for Lacers medical, dental, and vision plans will increase by 8.35%. Changes for 2026 are as follows. Scan Health Plan, newly available in California counties of Kings, Sacramento, San Joaquin, Placer, Tulare, and Yolo. Anthem Medicare Preferred. The preferred brands for continuous glucose monitors have changed from Freestyle to Dexcom. And Abbott is replacing LifeScan for preferred diabetic testing supplies. Access to Care will merge under Medicare Transportation Management, Inc. United Healthcare, effective December 31st, 2025. The Emergency Response System, PERS, benefit with Lifeline will be discontinued. Retirees will have the option to convert to private pay or discontinue services. 2026 premium changes. Kaiser premiums, specific to Kaiser HMO premiums and Kaiser Senior Advantage HMOs premiums will increase in 2026. For the Kaiser HMO single party, the premium $1,161.91 will see an increase of 43 cents. Pardon me, $43.63. The two-party plan, $2,000, $323.83, an increase of $89.26. For Kaiser Senior Advantage single party, $263.98, an increase of $1.51. For the two-party Kaiser Senior Advantage, $527.96, an increase of $3.02. 2026 subsidies and MPRP reimbursements. Because the 2026 Kaiser Permanente HMO two-party plan will increase by $89.26, the board has the authority to increase the maximum medical subsidy for retirees under 65 or with Medicare Part B only by the amounts from $2,318.58 per month to $2,407.84 per month. This is the same for the Medical Premium Reimbursement Program, MPRP, maximum reimbursement. The maximum dental subsidies determined by the active dental subsidies will be $42.93 per month for the PPO plan and $15.70 per month for the HMO plan. Income-related monthly adjustment amounts, IRMAs. IRMA is a surcharge on top of the basic standard Medicare Part B premium and Part D premium rates. Medicare enrollees whose modified adjusted gross income exceeds a certain threshold may be assessed in IRMA. Non-payment or partial payment of IRMAs and or allowing your Medicare premium payments to lapse will lead to cancellation of your Lacers medical plan coverage. Please contact the Center for Medicare and Medicaid Services for more information. Reminders. If you are planning on moving in the future, keep in mind that your plan may not be available in your new zip code, so you may only have emergency services available. Please contact Lacers at least 30 days before your move. If you are changing plans, be sure to check your new plan's prescription formulary and get your prescriptions filled before your effective date to allow time for your new plan benefits to get set up. If you are changing plans, please consult with your physician on whether they accept the new plan and are accepting new patients. If you or your dependents will be turning 65 soon, remember that you are required by the Los Angeles Administrative Code to enroll in Medicare Part B. And if you are eligible for Medicare Part A at no cost, you are required to enroll in Part A as well. The Center for Medicare and Medicaid may require your current plan to terminate your coverage effective the date of your move. Plan contact information is located on the back of the health benefit guide. You will be under a different contract in the plan where you are considered in the plan where you are considered a new patient. Do you have a new address, phone number, or email address? Complete and submit a change of address form. Adding, changing, or removing a beneficiary. Complete a LACERS designation of beneficiary form. Do you have a power of attorney? Let LACERS know for easier administration. These forms can be found on our website, https://www.lacers.org/forms-info-sheets. Open enrollment virtual meetings. Open enrollment virtual meetings are set for Kaiser on Wednesday, October 15th at 10 a.m. Anthem Blue Cross, Thursday, October the 16th at 10 a.m. United Healthcare and Scan, Wednesday, October the 22nd at 10 a.m. And Delta Dental on Thursday, October the 23rd at 10 a.m. Open enrollment in-person meetings are set for Doubletree, Ontario on Thursday, October the 30th at 10 a.m. Lakewood Country Club on Tuesday, November the 4th at 10 a.m. and Almanzar Court Thursday, November the 6th. We have made changes to the Tuesday, October 28th open enrollment in-person meeting. New information to follow. More information is available at www.lacers.org. Lacers Health Lacers Health Plan and Benefit Information, health benefit guides, videos, and more to help you understand your benefits and our health plans covered services and your health subsidies and possible premium costs. Health insurance carrier information, videos, presentations, flyers, and more to give you a deeper understanding of what each carrier has to offer. Our contact information is as follows. To submit documents, you may use Secure Document Upload at www.lacers.org/secure-document upload, secure document-upload. You may also email us at lacers.health@lacers.org or fax in your documents at 213-473-7284. For general questions, please email lacers.services@lacers.org. If you prefer to mail or meet us in person, you may visit us at 977 North Broadway in Los Angeles, 90012. Please keep in mind that if you're mailing in your enrollment forms, there is a delay. This can delay the process by at least 7 days. So if you are mailing us forms, please do allow at least 7 days before you contact us regarding the documents. We will now turn it over to Jonathan. He will give us a brief overview of our Lacers Well program.
Hello, everyone. My name is Jonathan, and I am a part-time admin intern here at Lacers. I am part of the Lacers Well team, and today I'll go over what Lacers Well does and what we do. Our theme for next year is Live Stronger, Longer. Lacers Well program. Our mission is to enhance the quality of life and retirement for Lacers members by providing resources and activities that promote optimal health and wellness. Lacers members automatically have access to all the benefits of the wellness program upon retirement. The Lacers Well program was formed to take an innovative approach to retiree health optimization through development of educational and interactive support to improve the health of retired Los Angeles City employees. Lacers health plans such as Anthem Blue Cross, Anthem Blue View, Delta Dental, Kaiser Permanente, SCAN, and United Healthcare offer webinars, seminars, and programs aimed to avoid unnecessary healthcare utilization, control healthcare costs, and optimize the quality of life for Lacers members throughout their retirement. There are 5 elements of well-being that wellness program promotes. 1 is for purpose, 2 is physical health, 3 is financial wellness, 4 is social engagement, and 5, community involvement. Lacers Well monthly activities and virtual offerings. Some of them include computer tech classes with Mom's Computer, Aging Well discussion group with the Foundation for Senior Services, brain health classes with Alzheimer's Los Angeles, Fitness Made Simple classes with Sean Foy, mental health webinars with the County of LA, financial mastery workshops, and estate planning seminars, carrier sponsor webinars, and many more. Lacers Champion. The Lacers Champion program gives retired members an opportunity to become a champion and work directly with the wellness team to plan, coordinate, and promote the health and well-being of our members through sharing a special skill, hobby, or activity that they enjoy either virtually or in person. We currently have champions who facilitate a multitude of different activities in various regions, such as Los Angeles, Torrance, Selmar, Sherman Oaks, Costa Mesa, Playa del Rey, Rowland Heights, Granada Hills, and Montebello. We also have champions that facilitate 2 of our virtual book clubs, 2 of our movie review clubs, and a virtual chess club. Lacers Well champions are the backbone of this program, and members can anticipate on a range of different activities that complement their personality, expertise, and personal goals. As you see on the left side, Ben Galleros, who's one of our champions, going on a hike with other members. Lacers Well Champion Program. Our in-person outdoor activities include park walks in Carrizo, with Irene in Silmar, pickleball with Leo in Montebello, Playa del Rey beach walks with Frankie, and much more. There's also virtual activities like book clubs with Bernadette and Jeanette, movie review clubs with Jeanette and Ratna, special movie discussions with Eugene, and virtual chess. If you want to become a Lacers Well champion, or you have any hobbies or interests that you would like to share with other retirees, feel free to email us at lacerswell@lacers.org, and our champion coordinator will get back to you. If you want to learn more about Lacers Well And you have any questions, feel free to email us or call us. Please also make sure to check out our website since we do have a calendar on there with more activities. And also make sure to follow our YouTube and Facebook page. We are very active on there. Thank you so much. And I will now turn it back to Michelle. Thank you so much, everyone. I will now turn it back to Chris Leah.
Thank you very much, Jonathan. Again, if there's any questions regarding Lacer Swell, feel free to reach out to um, anyone on the wellness team. We will now be turning it over to our main presenter. Today we do have Kaiser, and we'll have Blanca Lowe explain all of the wonderful benefits available to us.
Hey, Chrislia. Well, good morning, everyone. Welcome to your open enrollment. My name is Blanca Lowe, and today we're going to learn about the wonderful benefit services, online tools that we offer to you. So next. Okay, so Kaiser Permanente does provide you with high quality care, physical and mentally, and we love to connect with you. As you know, with Kaiser Permanente, we have connected care. So when it comes to your mental health, we're on top of it. Physical health, we want to be there for you, for your family, to care for your goals, all habits that we want to help you get rid of, and any things that we need to support you in. Our Kaiser Permanente care team is there for you anytime, anywhere. So next. Okay, so with Kaiser Permanente, your doctors, hospitals, health plan benefits work together to give you care wherever and at any time. So through the use of our electronic health record, we're connected to give you care, whether it's in person, virtually. Our doctors are on top of your health care, not just certain hours, but it is 24/7 that we provide virtual care via telephone or video visits as well. And mental health is also one of the things we also support you with your health. And with most plans, you get a range of care, preventive care at no cost. And if you need specialty care for maternity, cancer, heart health, or anything else, you have access to our cutting-edge technology and evidence-based care that we offer through our awesome doctors to partner up with your healthcare. So we're all used to getting instant information over our phones, right? And when it comes to healthcare, we do want to remind you to register at kp.org, or you could go through your store. And that way, you also have access to the latest and greatest care that our doctors take notes, whether you, through the use of our electronic health record. You could always read your lab test results anywhere, anytime. So we thrive on providing that care for you, but we also want you to have access to that care 24/7. So as you can see, you could always watch a video at kp.org, choose KP, or scan the QR code. But this is a way to make your life, healthcare, physical and mentally, better. So with Kaiser Permanente, as I was talking about the app, whether you want to get care in person or virtually, it is very convenient to that your care is with our doctors. So when you do the telephone and video visit, it's not a third party. It's nice to always hit that button, get care now, and it allows me to see my estimated time of wait that I have to wait. I've done it with a pink eye, right? One time I had a pink eye. I click on get care. I was at my friend's house, and actually it said that I had to wait 15 minutes. I waited 15 minutes, and then a doctor came online through video. I told her what I had, and she said, "Are you nearest to what pharmacy?" I told her. She sent the prescription, and there you go. So saving you time and money. And of course, you could always email your doctors with non-urgent questions. I've attached like a picture. I have sunspots, send it to my doctor, and I skip a trip, and my doctor was able to submit the referral to dermatology. So, there's many ways to connect with your doctors at Kaiser Permanente. You can always email them with non-urgent questions, of course, make or cancel appointments, refill your prescriptions. Also, a way to skip a trip to the pharmacy, right, where we could deliver your prescription at home. You could always look up your statements if you're owing any co-payments, look up facilities. I also, what I like doing is looking up through my medical records tab, like the history of my last physical, right? And what were my numbers in my screenings? Did I have any care gaps? Did I forget to do my mammogram, or are those screenings that we need to do? And as you notice, with Kaiser Permanente, sometimes you go pick up a prescription and they might tell you, hey, you're due for your mammogram. And I love that Kaiser is always on top of our members for preventive care. So we talked about, being in person, emailing our doctors as well, same day appointments, and being able to skip a trip to the pharmacy. And of course, we have ways of getting care through the mail order pharmacy as well. And then later on, I will talk about care away from home travel coverage. This is something that sometimes our members forget. And they said, am I cover everywhere? You are anywhere in the world for urgent care and emergency. Okay, so Kaiser Permanente has a wide range of personalized support, like I mentioned before, for your mind and body, mental health. You don't need a referral. So our Kaiser Permanente does provide support for several a wide range of conditions, which include anxiety, depression, addiction, autism spectrum disorder, bad eating habits. We go through life, and life hits us, and know that Kaiser has support for you. We do have a team of psychiatrists, psychologists, marriage therapists, not only just for adults, but for families, teens. So we're there to support your journey. And of course, we have a lot of health classes that you could choose from, online wellness tools. We have what's called wellness coaching by phone. So I always like to refer it like a buddy. So if you need support, maybe you're a smoker and you want to stop smoking, perhaps you're having trouble managing your weight, or you want to be more active, or you have stress. These are wellness coaching by phone. Coaches who support that journey, your health goal. You don't need a referral. It's completely free, and you set your own hours. It's via phone. They also speak Spanish. So this is a way, again, to support you and get you started on your health goal. So we're known for catching potential problems early. So through our robust preventive screenings, we are able to be successful. So hearing that, for example, that someone has cancer can be very overwhelming, right? But no matter what, we want to support you. So we do have a multidisciplinary team of cancer specialists that work with you and your family to find the best approach and treatment. Our specialists combine early detection and cutting edge research. And of course, we always want compassionate care during a time that is very difficult, not just for the person, but for the family. And we want to support that journey And we do a lot of research. As you can see here, Kaiser Permanente members are 30%, 33% more likely to survive heart disease and 20% less likely to die early of cancer. So this is Kaiser Permanente care that's world class. And then we go on to the gym membership, One Pass. This is available to everyone. So if you want to work out at home, at a gym, maybe you want to do brain training, it is available this at no cost to all of you. So I encourage you to go in there and find a gym that's near you or something that you could do at home. And you could do that through your onepass.com. So this is OnePass, and it gives you instructions here how to connect. Like I said, go to your onepass.com, enter your name, your date of birth, health plan member ID to create a OnePass account. And then you go through the features of OnePass, and then you search for the participating gyms that fit your needs, and there you go. You get started on your new journey of your exercise. And then here we have Kaiser Permanente. As a Kaiser Permanente member, you get fresh, healthy meals delivered to your home immediately after you have a hospitalization stay or skilled nursing. So this is upon discharge for inpatient. And you choose from over 70 entrees to support your dietary needs, including heart healthy, diabetic friendly, gluten-free meals. You could get 3 meals per day, and this is up to 4 weeks, and for a total of 84 meals that come included. Then you also get transportation to your doctor visits at no charge. It covers up to 24 one-way trips, 50 miles per trip per calendar year. So whether you want to use rideshare, taxi, or private transportation, you could do that as well. They also support if you have a wheelchair or gurney. There's also a van service as well. Request your ride at least 3 business days, and they are available Monday through Friday before your appointment. Okay, so for hearing aids, your plan allows you to have 2,000 allowance per year every 36 months. Okay. And then next is your vision coverage. So you'll get an allowance towards your eyewear purchase once every 2 years. And your allowance is 150 allowance. So that is every 24 months. Okay, so getting started. So this is whether you have questions after this, you could always go to that link that you see on your screen, or you could write the number that you also see on your screen and talk to a Kaiser Permanente enrollment specialist. Open enrollment begins October 15 and it ends on November 17. And again, here's the QR code if you wish to scan it with your phone. You could always go to that link that you see on your screen, kp.org/choose KP, or you could also call that number as well. Okay, we will now go to your benefits. There is no changes to your benefits, so everything continues to remain the same. I would remind you about your preventive care. Remember, it is very important to take care of yourself and stay on top of your health. And your preventive care doctor visits, they're still at $20 copayment. Telephone and video visits is a way to not pay anything, so no charge. Lab and your radiology is at no charge. Outpatient surgery continues to be at $20 copayment per procedure. Hospitalization is at no charge. Emergency is $100 per visit. Remember that if it's not life-threatening, try to use urgent care. That way you just pay the $20 copayment. But if you do happen to go to the emergency and you get directly admitted to the hospital from the emergency, then that emergency copayment will be waived, and then your hospitalization will be at no charge. Now, prescription, we do have prescription coverage. It's a $15 copayment for generic for up to a 30-day supply. Or if you are taking ongoing medications, you could always have them deliver at your home and save a copayment. So now it's a $30 copayment for up to a 100-day supply for generic. Or brand medication is a $35 copayment for up to a 30-day supply. Or if you deliver them to your home, it's a $70 copayment up to a 100-day supply. The only thing we do not deliver to your home is like narcotics, those type of things. You have to pick those at home. Now you do have chiropractic and acupuncture care, so you get up to 30 combined visits. And then it's a $15 copayment. This is not through Kaiser, it is through American Specialty Health, and you do not need a referral. Okay, again, the eyeglasses, contact lenses, you receive it every 24 months. And your allowance is $150. Hearing aids every 36 months, and it's $2,000 allowance for each year. And next, Senior Advantage. Again, preventive care on this one is at no charge. Again, no changes. Doctor visits at $15 copayment. Again, telephone video visits at no charge. Lab tests and radiology, no charge. Outpatient surgeries, $15 per procedure. Hospitalization, no charge. Emergency, $50 copayment. And again, as you can see, your prescriptions, you do have a $15 copayment for up to a 100-day supply. Now, if you, out of your pocket, you spend $2,100 in 2026, then after that, catastrophic, I cannot say that word for the life of me, catastrophic coverage, it becomes that. And so then you don't pay anymore after that. Chiropractic and acupuncture, again, the same as the $50 copayment per visit, and you're allowed 30 combined visits. And then it is through American Specialty Health, and you don't need a referral from a Kaiser Permanente doctor. And eyeglasses or contact lenses, you do get them every 24 months, and you have a $150 allowance. And then the hearing aids every 36 months for a $2,000 allowance for each year. Now we're just going to go over the service updates. So this just gives you an overall of Kaiser Permanente's. We have in California, that is 441 medical facilities across California, and over 17,700 doctors. And then we are top rated health plan in California for 9 years in a row. And our quality of care, 17 years of recognition for top rated quality medical care. And then leading California in 105 effectiveness of care of measures. This includes, for example, preventive and screenings, comprehensive diabetes care, cardiovascular care, mental health, maternity, and respiratory care. So these are our accolades. And then updates in Southern California, scheduled to open in 2026, the Aliso Creek Medical Office. This is the first quarter. It's going to be a huge one. And then we are going to have the 44 exam rooms and 29 provider offices. And then as you can see, all the departments that we'll have there, ranging from dermatology, family medicine, internal medicine, and what you guys can read there. And then Menifee Medical Office will be open fourth quarter of 2026. And then Riverside Medical Center will have an expansion fourth quarter 2027, adding 154 more beds. And this is our convenient locations in Southern California, our affiliated medical offices as well. And just a reminder, whether you're traveling or somewhere, know that Kaiser Permanente, you might, I don't know how long you travel, but sometimes, like for me, I live in Montana, but sometimes I travel all the way to Pasadena, Los Angeles. But if I see a medical office there and I need to see a doctor, I can stop there and do it, or do some labs or x-rays. What I like about it is that I don't have to worry about my doctor or primary or specialist getting the results, because through the use of electronic health record, they're able to access care anywhere, anytime, including myself. So just want to remind you that you always have one main primary care doctor, but you could access other medical offices. So we also have our target clinics in Southern California. I believe we're up to 35 and adding more. Now, the target clinics are like when you go into Targets and you see Starbucks, you're also going to see Kaiser Permanente's logo. So basically, we're there with our team, care team. It's not going to be a third party. So again, access to our clinicians. Now, this is only though for minor illnesses and minor injuries. If you want to go do your flu shot there, you can. They accept walk-ins, but we ask you to go on to the Target Clinic's website, Kaiser Permanente Target's website, and log in and make an appointment. And let me give you an example. So there's no pharmacy there, right? But let's say you go and you have, again, I'll say an example, pink eye, and they give you a prescription. You can refill one time only that prescription there at that pharmacy in Target. Okay, as long as they prescribe you that prescription when they see you, then you can do it that one time. Okay, but I wanted to make you guys aware. I know many of you might shop at Target, and maybe you want to walk in there and get a flu shot. You can do that too. Maybe you have a minor illness, injury that you want to take care of. There is convenient hours there, as you can see on the slide. So this is updates in Northern California. So this in Modesto, a new sports medicine center opened up in August of this year. And then also the Fresno Orchard Plaza opened in 2025 in October. So this is this month. And then Modesto Medical Office is opening January of 2026. And the ones below are the medical offices that recently opened this year and at the end of last year. And these are, again, our convenient locations in Northern California with our affiliated medical offices as well, hospitals, medical offices. So this is Kaiser Permanente away from home care travel coverage. So as you can see, the US, right? If you travel to any of the states where you find Kaiser facilities, Northern California, Oregon, Washington, Colorado, Hawaii, Georgia, Virginia, Maryland, and Washington, D.C., you could access care there. They'll just give you a different medical record number. Same copayment applies, nothing changes. If you happen to visit one of the states where you see those symbols, you could use the Cigna PPO network, Concentra urgent cares, the minute clinics, and the little clinics, including the pharmacies. So what happens is that you just pay a copayment and you're done, right? You don't have to submit a claim or nothing like that. They'll go ahead and accept it. If you go to kp.org/travel, you're going to see all this stuff that I'm talking about. Now, if you go to a state where you might, or more likely will not see Kaiser Permanente, the Cignas, Concentras, mini clinics, or the little clinics, they might go ahead and ask you to pay upfront. If they do, go ahead and do it. When you come home, you can submit a claim and get reimbursement. I know they will bill you and they will bill Kaiser. Okay, but we do have also the away from home travel line that's available 24/7. If you download the app or you go online, you'll see that number. Okay. Now, when it comes to internationally, you'll also cover for urgent care and emergency. So you go to another country, yes. The only thing is that you 100% have to pay up front and then come home, submit a claim with an itemized bill, your airline tickets, and then Kaiser will reimburse you as well. Okay, if any of you have dependents that are away from college, they'll also cover for urgent care and emergency as well. This is a national snapshot of all the regions that I mentioned, and the members that we have in each region. So with, of course, highest being Southern California. So anyways, this is just a footprint of what we have. If you go to the next one, just for your own references, our communities. I don't have to say anything. And yeah, this is just the good health we have done everywhere. The numbers. So thank you for your time and attention. I thank you.
Thank you very much, Blanca. It's a great presentation. Thank you all for your questions. As a reminder, you can find more details in our health benefit guide available on our website at lacers.org under retirees health benefits. There's a breakdown of the different plans that are offered and a brief overview of the plan benefits. For specific questions regarding the plan, you can reach out directly to us at lacers.health@lacers.org. You can also give us a call at the 1-800-779-8328 number. Please ensure to complete your enrollment forms if you are switching to Kaiser, and provide all the corresponding documents. You can submit all your forms via secure document upload, which is available at www.lacers.org/secure-documents-upload. Thank you all. This concludes our webinar for today. I hope you all have a wonderful day. And again, thank you for joining us.